Hello everyone. Today we're going to talk about something that can be a little bit scary, but is very important to understand: burns. A burn is an injury to our skin, which is the amazing outer layer that protects our body. Sometimes, things that are very hot or even very cold can hurt this protective layer. It's like when you leave a piece of toast in the toaster for too long and it turns dark and brittle. Our skin can get damaged in a similar way if it touches something it shouldn't. This damage needs special care to help it heal properly. So, what causes these burns to happen? Most often we think of heat. This could be from a hot liquid like tea or soup spilling, which we call a scald. It could also happen from touching a hot object, like an oven, an iron, or a hair straightener. Even spending too much time in the sun without sun cream can give you a sunburn, which is another type of burn caused by ultraviolet rays. It's not just heat though. Strong chemicals, like some cleaning products, can cause chemical burns, and touching something with electricity can cause an electrical burn. It's really important to know that burns can happen to anyone, at any age, and often happen by accident. A moment of distraction in the kitchen, a trip while carrying a hot drink, or a science experiment gone a bit wrong can lead to a burn. That's why being careful around hot things is so crucial for keeping ourselves and others safe. But accidents do happen, and when they do, knowing what to do and how doctors and nurses can help is the first step to getting better. We are here to help you understand the process. The skin is our body's biggest organ, and it does so many wonderful jobs for us. It keeps germs out, helps control our body temperature, and lets us feel things like a soft blanket or a cool breeze. When the skin gets burned, these important jobs are disrupted. The deeper the burn, the more help our skin needs to repair itself and get back to its job of protecting us. That's why getting the right medical help from a nurse or doctor is so important for any burn, big or small. Now, let's look at the different types of burns. Doctors and nurses often talk about them in degrees, which is just a simple way to describe how deeply the burn has gone into the skin. The first and most common type is a first-degree burn. This is a superficial burn, meaning it only affects the very top layer of your skin, called the epidermis. It might look red, feel a bit swollen, and be painful to touch, just like a mild sunburn. These burns usually heal on their own in a few days without leaving a scar. Next up, we have second-degree burns. These are a bit more serious because the damage goes deeper, affecting both the top layer, the epidermis, and the layer underneath it, the dermis. A second-degree burn will look very red and swollen, and you will almost always see blisters forming. These blisters are little bubbles of fluid that the body creates to protect the healing skin underneath. This type of burn can be very painful. It needs careful medical attention to prevent infection and help it heal properly, which can take several weeks. The most serious type is the third-degree burn. This is a full-thickness burn, which means it has damaged or destroyed both the top and second layers of skin, and might even reach the fatty tissue underneath. The strange thing about these burns is that they might not hurt as much as a second-degree burn, because the nerve endings in the skin that feel pain have been damaged. The area might look white, leathery, or even charred and black. These burns are a medical emergency and always require specialist care in a hospital. It's helpful to think of your skin like a multi-layered cake. A first-degree burn just scrapes the icing on top. A second-degree burn goes through the icing and into the first layer of sponge. A third-degree burn goes all the way through several layers of the cake. Understanding these differences helps nurses and doctors decide on the very best way to care for the injury, ensuring that the skin gets the exact help it needs to begin the amazing process of healing itself and getting you back to feeling well. Let's imagine a scenario. A young boy named Leo, who is 8 years old, comes into the clinic with his mom. He was helping make pancakes and accidentally touched the hot pan. He has a burn on his hand that looks very red and has started to form a small blister. Leo is crying because it hurts, and he is a bit frightened by how his hand looks. This is a very common situation, and the first thing a nurse does is to be calm and reassuring. The nurse will tell Leo and his mom that they are in the right place to get help. The nurse's first step is to assess the burn carefully. This means looking closely at it to see what type it is. The nurse sees the redness and the blister, and knows this is a second-degree burn. They will ask Leo's mom what happened, and if they did anything at home, like running it under cool water, which is a great first aid step. The nurse needs to check how big the burn is, and make sure it's not on a tricky part of the hand, like over a joint, which might need extra special care. After the assessment, the next step is cleaning the area very gently. The nurse will use a special sterile saline solution, which is just salty water that is very clean, to carefully wash the burn. This helps to remove any dirt and reduce the risk of germs getting in and causing an infection. The nurse talks to Leo the whole time, explaining what they are doing in simple words, like, "I'm just giving your hand a little wash to make it super clean." This helps Leo feel less scared and more in control of the situation. Once the burn is clean, it's time to put on a special dressing. The nurse will not pop the blister, as it's nature's own plaster. Instead, they will apply a soothing cream that helps prevent infection and then cover the burn with a non-stick dressing. This dressing protects the delicate new skin, keeps it clean, and stops it from rubbing against his clothes. The nurse will then gently wrap a bandage around his hand to keep the dressing in place, making sure it's not too tight so Leo can still wiggle his fingers. Managing pain is one of the most important jobs for a nurse when caring for someone with a burn. Even a small burn can be very painful. The nurse would make sure Leo is comfortable and might suggest a simple pain medicine that is suitable for children, like paracetamol or ibuprofen. They will explain to Leo's mom when and how to give the medicine at home to keep the pain under control. The nurse also comforts Leo, telling him he's being very brave and that the pain will start to get better soon, which is very reassuring for a worried child. Monitoring for infection is another crucial part of burn care. An infection can make the burn worse and slow down healing. The nurse will teach Leo's mom what to look for. They will explain the signs, such as the redness spreading, the area feeling hotter, any unusual fluid coming from the burn, or if Leo starts to feel unwell or gets a high temperature. The nurse will schedule a follow-up appointment to check on the burn in a few days, and will tell Leo's mom to call the clinic if she has any worries before then. Beyond the physical care, nurses provide vital emotional support. A burn can be a scary experience, especially for a child. The nurse spends time talking to Leo, maybe distracting him with a sticker or a funny story while they change the dressing. They praise him for his bravery and reassure him that his hand will heal. This kindness and gentle approach helps the patient feel safe, cared for, and less anxious about their injury. This emotional comfort is just as important as the medical treatment for a speedy and positive recovery. In conclusion, proper nursing care is the cornerstone of helping someone recover from a burn. From the initial assessment and cleaning to expert dressing, pain management, and watching for infection, every step is vital. Nurses use their skills not only to treat the physical wound, but also to provide comfort and reassurance during a stressful time. Good burn care ensures the skin heals as well as it possibly can, reduces the risk of scarring and infection, and helps the person feel safe and supported on their journey back to full health.